just for those people that are joining us for the first time this week or weren't a part of the town hall last week, we really took a look at a philosophy and a mindset that Stambaugh Ness introduced almost 2 years ago, and that is a role or a philosophy of being an anticipatory organization. And even last week, I used the term pivot. And when you think about pivot, that's more reacting than being preactive. So last week, we shared with you just a number of areas that we're really encouraging people that you got to start to think about as what we're referring to as the roadmap to reentry. And it's this whole concept of being preactive and things that you can do. And actually, many of those things are going to become must-dos, as even as Tom mentioned, it seemed even with this PPP, those of you that participated in the webinars weeks ago, as we were talking to you, things were changing. Well, when we were talking to you last week about this roadmap to reentry, the next day you started to hear governors saying, hey, we're going to start opening up, and here are some of the criteria. So last week we talked about a number of functional areas that we really think you need to take a preactive. You got to be thinking about today, what you're going to be doing tomorrow. And one of the 6 areas that we talked about were facilities, finance. We talked about customers and contracts, reaching out to them, finding out where they are, talking to your supply chain people. Are they going to be able to provide the products and the materials, operations and personnel? But the one that we really resonated with us, because you need some lead time, is getting that environment, creating that facility so that your people, that as they are able to come back, they have that comfort and ease knowing that they're in a safe environment. And to that end, I'm going to be introducing here, and Chris on the screen right now, but Chris Baker is with Hillmann Consulting, which is a well-recognized leader in the environmental consulting, risk management, loss control, and has been providing these services dating back to 1985. Interestingly, the firm originally was established in New York City, so you can only appreciate the complexities, the regulations, and the aggressiveness in those markets. And we all know that that's been a critical hot spot here with the pandemic. But it was this early experience that afforded them the unique opportunity to design protocols that would later become the foundation for the services that they've built. Hillmann Consulting is strategically positioned to provide these services to the market and is working with a vast number of different owner-occupied commercial real estate across the United States. Chris, who's going to be joining me right now, is Vice President of Operations at Hillmann, responsible for business operations, fiscal management, field staff management throughout the company, in excess of 30 years. And of particular interest, Chris is responsible for the performance and management of the industrial hygiene services. So with that, Chris, I'd like to hear a little bit about what Hillmann's seeing, and particularly with you located in the New York, New Jersey area. I'm sure you're having a lot of activity. So Chris, thanks for joining us today.
Thank you, Rick. I appreciate it, and Hillmann appreciates the opportunity to speak to everybody. Yeah, it's a little crazy here in New York City. Like most people, we've been reactive. When the pandemic began, we spent a lot of time with clients, helping them react. How do I clean my building? I just had an infected person come in. What do I do? And a lot of our work was reactive in nature. And it's funny you mentioned pivot, because really in the last 2 weeks, just talking to our clients, they're ready to pivot to how do I reopen, and what does that look like, and what does that mean? And some of our buildings have been completely closed. Some of them have been operating very lightly. Some of them have been close to normal occupancy. Honestly, it just depends on the tenant and the client we're working with. But the majority is on slim to no staff. And so we see, as we pivot to get on top of this and move in front, there's 3 main things we all want to think about, is getting our facility, whether it's our suite or office building, ready for people to come back, and making them feel confident that it's safe to do so. When they start coming back, is making sure we clean. We're going to be living with COVID until there's a vaccine. So what is, if we come back to our offices, what does that look like when we've been told now for months to social distance and to wear a face covering? And how do we do that when I have a cube farm out here that I work in? So how do we clean properly moving forward? And the third part, which is there's not a lot of guidance out there, and it forces us to be creative, which is kind of fun, frankly, is creating social distancing guidelines for reoccupying our buildings. So I'm going to kind of go through each of those three briefly, and I want you to start thinking about these things because we do need to start thinking now about them. So I'll start with getting your facility ready to reopen right now. The first thing that we recommend you do is to actually go through your facility, to get out there as soon as possible to walk through. Hopefully you've kept some kind of ventilation going. Buildings that tend to have no ventilation can have humidity issues. Humidity causes condensation and potential mold growth. So you want to walk through the interior of your space, taking a look at things like potential mold growth on furniture, particularly fabrics. Have there been any water releases? Go through kitchens, go through slop sink areas, janitorial areas. Make sure you haven't had any water issues. Make sure the garbage has been picked up. Something as simple as somebody leaving their lunch in their desk can lead to odor issues that nobody can understand until that employee goes through a desk. So getting on top of it, look for that. Vermin issues. If there's been nobody there, the mice tend to take over. So you want to get in there and look at it. Look for things like floor drains and sinks. Make sure the water traps are full. If they evaporate and dry out, you're going to start getting sewer odors in the building. So that's something very simple you can start doing. And honestly, you want to be doing that kind of on a weekly basis if you can. The HVAC system is obviously key. It supplies us with fresh, clean air. So you want to have your mechanical contractor come in and do an inspection of the interior, change out my filters, upgrade my filters, and moving forward, one of the things CDC points out is having increased filtration capacity. So, a lot of people put in the nice cheap filters, which don't really do much for you, frankly. They just keep the dust off the coils, which is good, but we want to protect the occupants too, right? So we want to increase filtration to MERV levels 13. I know most of you probably don't know what that means. Your contractor will. And not every air handler can do that, but that's something you want to consider. We do want to increase the outside air, especially if you've been running on a limited basis or not at all. We want to put the system back on normal. We want to start purging the building with fresh air. So one, it'll smell better. And something a lot of people haven't considered is, over the years we've gone to these green cleaning chemicals that aren't as harsh. But we've had to switch to chemicals that can clean a virus. And those chemicals are not green chemicals. And so a lot of them have odors. A lot of them are not what we're used to. So there's going to be a lingering odor problem within a space. And so we want to increase the outside air in our mechanical system so that we can move that odor along. We have a saying, the solution to pollution is dilution. Well, in this case, we want to dilute with fresh air. As part of air handling systems, you want to make sure your exhaust systems are operational. Make sure the bathroom exhaust systems are still operating, that a bird hasn't put a nest in it and started blocking it up, that our garages, if you're in a building with subgrade parking garages, make sure the exhaust fans are operational and that they're on, that they haven't been de-energized to save money. Well, now with the staff coming back, we need to make sure they're working. Obviously, kitchens, restaurants, cafeterias, make sure their filtration systems are on and operational so that we don't have a problem there. And then the third thing, and CDC has really made a big push on this, is your domestic water system. If water's sitting in pipes for a long time, it's going to lead to bacterial issues. So, you're going to say, Chris, I get my water from the city, they chlorinate it or disinfect it in whatever system they use. That's true, but water sitting stagnant will naturally off-gas that chlorine. And so the water loses the ability to fight off a bacterial infection. And there is, frankly, natural occurring bacteria in our water. So if we lose the chlorinization, you can start to get bacteria growth. particularly Legionella. So we want to go through our buildings now and start flushing them and flushing them well. We want to replace the building that's sitting in all the water sitting in the pipes of our building so that we have fresh water in. Hot water heaters are extremely important. Warm water tends to lead to more bacteria. So we want to make sure the water that's been sitting in hot water heaters gets replaced. You want to do that now if we're opening within the next couple of weeks, even within the next month. Flush it now, and then have maybe every 2 weeks do a flush until people start coming back. But that is really a big health concern. That stagnant water has been sitting there. If you have a gym, in the basement of your building, all those hot water shower heads, all that needs to be flushed thoroughly before people start using it again. So that's the basics of getting your building ready. Cleaning. So a lot of us had already switched to more what we call enhanced cleaning more often. If you're in a building with a central lobby and elevator system, we have started cleaning that much more often. And we're going to have to continue that, right? Because we don't know. I might be carrying the disease. I don't even know that. We're going to have a lot of people coming back in various stages that we don't even know. So we're going to have to keep cleaning high-touch surfaces, elevator buttons, door handles. Anything people are touching, we're going to have to keep cleaning so that somebody else doesn't come along and touch that and maybe pick up the virus. So this enhanced cleaning is going to continue. One of the early issues we found were people not using proper chemicals for the cleaning. And if you're not sure, I would tell you to look for the EPA ID number that should be on the label of the bottle that you're getting your chemical from. Google EPA list N as in Nancy, and then there's a spot you can put that EPA number in, and if that chemical shows up on that list, then it's appropriate for COVID work. And I would just warn you that the name that comes up on the EPA list is going to probably be the primary ingredient that fights the virus. It won't come up as Clorox 360 because that's a trade name. It just comes up. As long as that EPA ID number shows up in list N, you're good to go. That's what you can use. And we're going to have to start thinking about within our tenant spaces having disinfection wipes available for our staff to use. Internally, things like copiers, scanners are central points that multiple people are using. So we're going to need to keep cleaning those surfaces all the time, just between our own staff using it. And we're going to want to put hand sanitation stations out so that people can sanitize their hands routinely. Obviously, we want to encourage hand washing as much as possible. I know the state of Pennsylvania is requiring hourly hand washing. I'm not really sure how you enforce that other than maybe signage, making sure supervisors are aware and remind staff to go out and wash their hands hourly. But it really is an effective control to help stop the spread. And then the third thing that you need to get creative and start thinking about is how do I social distance in my workplace? What does that even mean? So the first thing we want to always start with is tell our staff if you're sick, stay home. If your spouse or somebody living with you is sick, please stay home. Don't introduce that to our workplace. So that's always going to be our primary. We should be requiring face masks, and I'm sure different states are going to have different levels of requirements on that, so it's something to keep an eye out for. But we think that's a good basic practice. We're going to have a direct flow in and out of our building. What we're trying to prevent is, or what we want to encourage is the 6-foot social distancing. So maybe we use one set of doors to enter and one set of doors to exit. If we have turnstiles in a building, the same thing. Creating an exit line for the elevator and maybe a wait station for the elevator so people can get off before the next crew get on the elevator. How many people could be on an elevator? Your average elevator is like 5 by 5. So, excuse me. So you're going to have to think that if you're a building manager, how many people are allowed in this elevator? You want to identify choke points. Where do a lot of people come together at one time? And come up with a strategy to limit that. We don't want a lot of people coming in the same way. Maybe your space has a main entrance, but there's exits off on the corridor. So maybe you can make the main entrance an entrance only, and tell people that they have to flow through the hallway entrances as an exit. So that way you don't have people back and forth crossing each other. You have to do what I've heard some architects call de-densify. Less people in a given space. Maybe you've got 3 people, in a 200 square foot office area, and that's not quite enough space to keep 6 feet between them. So maybe you make that only a 2-person or 1-person office. Maybe you stagger your shift times or when you had different departments come in, so you don't have everybody showing up for 8 o'clock start time, but maybe you do 7:30, 8:30, so you don't have as much of a crowd, which then lends itself to lunchtime staggering it, because typically we all, people kind of come in whenever they need and want to come in, but we all take lunch between 11:30 and 1. We can't have that many people coming in and out at the same time. So by staggering start times, then we want to stagger lunch times. Again, just to work on crowd control and have less people coming through. Conference rooms, we really got to limit the number of people in the conference room. Maybe continue doing things. I know we're all getting a little tired of Zoom and webinars like this, but maybe you need to keep doing that just so you don't have everybody in a conference room at the same time. And when you do have to do it, remove every other chair. Space out. My wife works for the Corps of Engineers, and the Army has set up a rule where literally they measure 6 feet between each chair, and they have no more than, I believe, 6 is the most they even allow in a conference room. So even an organization that large is really struggling with this, but that's the kind of rules you have to look at, because you could wipe out the entire accounting department if somebody sick is in that conference room with you. So other things you could think of, a lot of us hotel workstations where we have staff use it for a couple of days a week. That we got to be really careful with that, right? Because these people are working somewhere else and coming in, and they're sharing a telephone. Like this is the dirtiest part of your day here, this telephone. And how often does it really get clean?
So on hoteling, we also have to make sure that we clean things like keyboards and mouses, anything we share. We really want to try to eliminate that if at all possible, the sharing of stuff, because you just don't know who's got it or had it, and we don't want to pass that along. We want to limit deliveries to only necessary deliveries. I am guilty of sending my Amazon packages to the office, but we really want to try to limit that moving forward. Visitors, we want to eliminate visitors to the extent that we can. Just because we don't want to bring in an outside, person into our office at all possible. And then the last thing I would say is consider the exterior. Now the weather's getting nice. People are going to eat outside. Restaurants are still closed, at least at the moment. So they got nowhere to go for lunch, and people will tend to congregate outside. So you want to make sure you put maybe signage up, remind people to do 6-foot distancing, and that's pretty much it. I mean, there's a lot to think of there. That's what we're struggling to work with clients on, so that they're operational and hopefully keep people safe as possible.
Chris, again, just thank you very much, for joining us today.